Hello, my name is Dr. Emer Barrett. I am an assistant professor in the discipline of physiotherapy in Trinity. And today I'm going to talk to you a little bit about physiotherapy as a career and give you some details about what the physiotherapy course here in Trinity involves. So first of all, what is physiotherapy? Well, physiotherapy is a science-based health profession. We're concerned with health promotion, with injury prevention, with restoring function, and basically maximizing human potential so that people can live full and enriched lives. So as physiotherapists, we help to restore well-being to people following an injury, pain, or disability. So chartered physiotherapists act as first contact practitioners and also as part of multidisciplinary healthcare teams. So we can assess, diagnose and treat conditions and illnesses that affect people of all ages, so from premature babies right through to the older people and all different social groups. And essentially what we're focused on is trying to promote healthier lifestyles for all. So there's some core skills of physiotherapy. The first is movement and posture analysis. Therapeutic exercise makes up a very large part of our work, so that's the prescription of exercise, both to prevent and manage chronic disease and also to rehabilitate people following an injury. It could be the application of manual therapy, so things like soft tissue skills and also mobilizations and manipulations to increase range of movement and decrease pain. And a large component of our job is also education. So educating patients and their carers and families around their condition and how best to manage it. So what do physiotherapists do? Well, essentially we treat a broad range of physical problems that present in all the different systems in the body. So the neuromuscular, the musculoskeletal, cardiovascular and respiratory systems. And as I said, our main aim is to try and help patients to achieve their maximum potential. So who do physiotherapists treat? Well, most of you are probably very familiar with the physiotherapist running out onto the sports pitch and treating musculoskeletal type injuries. So back and neck, joint problems, sports injuries, work-related disorders. But we treat a lot of other conditions as well. So a large component of our work as well would be working with patients who have had a neurological event or have a neurological disease like Parkinson's or multiple sclerosis. We work in orthopedics, so this may be treating patients who've undergone a hip or a knee replacement surgery or have multi-trauma following a road traffic accident. We would work in cardiac care, so providing cardiac rehabilitation for patients who've undergone heart surgery. We work in pediatrics, so this could be helping babies in special care baby units or children in developmental clinics. We would advise on antenatal and postnatal care, so including things like posture and exercise for women's health. Another core area is respiratory. So this could be teaching patients with, for example, asthma or chronic obstructive pulmonary disease, how to overcome their breathing difficulties and how best to prevent infection. And then we also treat sports teams and athletes, so helping them recover from injury, returning them to full fitness, or it could be doing pre-season assessments and fitness monitoring. Maybe you don't like humans so much, you prefer animals. Well, some physiotherapists will choose to specialize in veterinary physiotherapy. So where do physiotherapists work? So as I outlined, we work across all of the different systems of the body. So traditionally, physiotherapy was hospital-based, but really in the last decade, this has expanded hugely. So physiotherapists now work in a whole variety of workplaces. Obviously, the hospital is probably the one most people are familiar with, and physiotherapists would be based in all of the major departments, medical, surgery, intensive care, rehabilitation centres within a hospital. We also work in community and primary care centres. So this would be a mix of maybe bringing patients into the primary care clinic, outpatient clinic, but also visiting patients in their home, maybe prescribing advice and appliances to help them improve their independence and stay in their home longer. We work in special schools, helping children with disabilities. In the workplace, so maybe providing ergonomic assessments, teaching workers the correct techniques in lifting and handling, for example. We work in sports teams, so again, recovering from injury and helping restore athletes to full fitness. A lot of physiotherapists will be based in a private practice, so here they assess and treat a wide variety of conditions, predominantly musculoskeletal type caseloads. And then there's also people like me who are based in a university, so who will be involved with lecturing, with research, and with clinical education. So what qualities are needed to be a physiotherapist? So physiotherapy may be the career for you. Firstly, if you enjoy working with people, this is really important. If you have relatively good practical skills, you're a good communicator, and you also need to be reasonably fit. So this is important. If you can imagine, for example, a patient who's had a stroke is paralyzed on the right-hand side of their body, you as a physiotherapist need to be relatively fit in order to help them to move, to stand up, to be able to walk again. So if you think you would enjoy the challenge of assessing a patient to identify his or her needs, and then of planning and carrying out a course of treatment, then physiotherapy may be for you. It's important that I tell you as well that there is a high academic demand and workload associated with this course. So, yes, we want you to come to college and enjoy yourself, of course, but just to be aware that the physiotherapy course is very much 9 to 5 days a week. So what does the course in physiotherapy involve? Well, it is a 4-year degree course that leads to a professional qualification. So at the end, you can work independently with patients. And there's 2 main components to the course. There's the theory side and then the practical side. In the first 2 years, it's very much about laying down the foundation in terms of the theory. And then as you move to year 3 and 4, half or 50% of the time is associated with clinical practice. So year 1 is very much about learning the theory around the basic sciences. So anatomy, physiology, chemistry. Most of this takes place down at the main campus in college. And then from year 2 on, you begin to learn more physiotherapy specific skills. So in the core areas of manual therapy and exercise and biomechanics. And you'll also begin to learn more about the conditions or the main specialities or areas that physiotherapists will work, like neurology, musculoskeletal, and respiratory. And from year 2 on, most of the classes take place in the Trinity Centre, which is in the St. James's campus. So here are just some pictures of students learning how to teach an exercise class, how to teach exercise technique correctly. Here we've got a picture of a student teaching a patient who's had a shoulder injury. So she is teaching them strengthening exercise for the shoulder and for the scapula or for the shoulder blade. And in the second picture, you can see a student who is mobilizing a patient's back, so treating a patient with back pain. Then in year 3, you will go study in more detail the clinical sciences, so the main specialities, and you'll also begin to develop some more specialist knowledge around areas like research methodology and statistics. So a large part of the placement a large part of the course is concerned with clinical placements. So students complete about 1,000 hours of clinical placements as part of their 4-year degree. So these are supervised practice that take place in the workplace. The majority are 6 weeks, and they're placed across all of those variety of workplaces that I explained to you earlier. Students will undertake 5 placements, which start at the end of year 2 and go right through to the end of year 4. And we have excellent links with the large university teaching hospitals in Dublin and a lot of the specialist services that would be focused in and around the Dublin area. So here you can see 2 of our main teaching hospitals. So we have St. James's and Tallaght University Hospital. And at any one stage, we would have about 8 to 10 students placed in these hospitals. working under the supervision of a qualified physiotherapist, and we also have tutors on site which help support the students as well. So this can be nice for students. It's a nice break from maybe the harsh going of the theory. You get out to the hospital environment and you get to practice your skills in a clinical environment. So this is just the clinical placement structure. So at the end of year 2, there's 1 6-week placement and then 2 6-week placements each in year 3 and year 4. So here we've got a picture of a student who is learning to auscultate or to listen to the breath sounds in a patient who's got respiratory disease. And there you can see that the tutor is listening in just to verify what the student hears as well. And in the second picture, we've got a student learning how to use BiPAP, which is a form of positive pressure breathing, just to help a patient who maybe has asthma or a chronic obstructive pulmonary disease, enabling them to breathe a little bit easier. Again, we've got a student on the left-hand side in a musculoskeletal placement who is learning how to palpate or feel the movement of the spine. And then on the right, maybe an orthopedic patient who is being taught how to walk with crutches. So in the 4th year, a large component of the year is undertaking a research project. So for example, I had students last year who worked with Trinity Sport and the Health Promotion Officer to design and evaluate an active break for students. So this was a video of exercises that was designed to be delivered during lectures to help break up the prolonged periods of sitting that students would suffer. So we know that prolonged sitting is associated with poor health outcomes. And then students will also study in more detail some specialist areas like sports medicine and ergonomics. So here we have a picture of a student undertaking their final year project, and they're doing fitness testing, and this is being carried out in our exercise laboratory on the James's site campus. And then another kind of very good opportunity within the program is the Erasmus program. So the discipline of physiotherapy have links with the Karolinska Institute in Stockholm in Sweden, with Bergen University in Norway, and with Malta and Germany. And this is a European-wide program where students get to undertake a semester of their study abroad. So over the past number of years, we've built excellent partnerships with these sites, and we have students traveling out for a semester in their final year to complete that semester abroad. So if you like international travel, or you think this is something that would interest you as part of the course, this is a very good opportunity within the program. So on qualification, you're entitled to join the Irish Society of Chartered Physiotherapists and also CARU, which is the National Health Professional Regulatory Body. You're entitled to use the title Chartered Physiotherapist. And as a Chartered Physiotherapist, you're a specialised member of the healthcare team, so recognised by the medical profession, the Department of Health, and also the leading health insurance companies. So I'd just like to thank you very much for your attention, and you can get further information on the course on our website, or further information on physiotherapy as a career on the website of the Irish Society of Chartered Physiotherapists. Thank you.